Hi there, and welcome to A&P with Dr. O. Let's talk about abdominopelvic regions and quadrants. To help us visualize these, we're going to use this figure from the Anatomy and Physiology OpenStax textbook. Let's go ahead and get our bearings. When we're looking at an image, we're going to go ahead and act as though we're looking at a patient. And if this was our patient and we're looking at our patient, this would be the patient's right side, and this would be the patient's left side. Same thing over here. And I like to write it out as just a nice visual, and especially when we're practicing right versus left, it can kind of help to note that on these diagrams sometimes. That means that this is going to be my right side regions over here, and then my left side regions are going to be over here. All of these are abdominopelvic regions. I'm just going to put the names because I don't have a lot of room to write out the term region as well. So I'm just going to put the names of each region here as we go through. Now, we have this dashed line here that is representing the diaphragm. And that helps us separate out this thoracic cavity from the abdominopelvic cavity that we see inferior to that thoracic cavity up here. Our first region we'll look at is the right hypochondriac region. And we know that the term hypo means below, chondro means cartilage, and it means below the cartilage of the ribs. Here's the ribs. Here is cartilage that is helping these ribs connect to the sternum. Since we are below that cartilage, we call it hypochondriac. We would have the same thing on the left side. We would have the left hypochondriac region. Let me go ahead and erase that a little bit at the end. That way we can just be a little neater with that. That's better. Moving on, we then come to the right lumbar region. Lumbar, think lower back. It's kind of associated with that area. We would have the same on the left side, the left lumbar region. And then finally, we would have the right and left iliac regions. And another name you might see for this would be the inguinal region, and that's okay to use as well. Either term is fine. Then we have these three regions in the middle. This region right smack dab in the middle, you can kind of think about it roughly where the belly button would be, where that umbilical cord falls off. And that can help us remember that this is the umbilical region. And then we have a region above and below. Another word or prefix for above is epi. This is going to be the epigastric region here. We know that hypo means below, and this is known as the hypogastric region. My apologies. Let me get that a little bit better for us. But that is known as the hypogastric region. I'll hyphenate it. And you can also call it the pubic region. That's another name for it that is acceptable to use as well. Over here we have our quadrants. Again, we're going to have quadrants on the right side and the left side. And then we'll have quadrants that are upper and those that are lower. Now, these quadrants have abbreviations. Anytime you see an abbreviation or we use an abbreviation in class, it is acceptable for you to use. And I think it'll make it a whole lot easier to label using the abbreviations. We know that this is the right side and this is the left side. We know that this is upper, this is lower, and we know that now we're dealing with quadrants. We have our right upper quadrant, our left upper quadrant, our left lower quadrant, and our right lower quadrant.